Welcome to the Wealth Podcast, Off With Your Coat, a podcast on women's health and wellness where we flip the script and ditch the surface level chatter. We need to ask the real questions. Let's get back to storytelling and back to basics to help us uncover how to set ourselves up for true health and wellness and pass it on. I'm Cat Duff, founder of GenWell, the women's health advocacy brand building wealth, the intersection of health and wellness. Some days it's me and a doctor, coat off, talking about what really matters. No fluff, no filters. Other days, it's East meets West, trading tools, not punches, to help move women's health forward. We're building generational wealth. Come with us. Coats off, let's go. Okay, after this episode, I now know we do not know anything about our pelvic floor, and it is literally holding us together, both physically and figuratively. Today, we're joined by Kathy Cates, a board-certified family nurse practitioner and co-founder of the Institute for Pelvic Health. Kathy is a leading expert in pelvic floor, sexual, and hormonal health with advanced training from the MGH Institute of Health Professionals. In this episode, she gives us the one-on-one on the pelvic floor, explains why every woman should have a pelvic health baseline starting at age 16 with annual visits, dives into the full spectrum of sexual health, and shows us how hormones tie the entire picture together. Kathy, we are so excited to have you. Kathy, welcome to Off With Your Coat. Thank you for being here.
Thank you so much for having me, Kat.
I think we have so much in common, not only just being in the health space, but I think the way that we look at women's healthcare and the approach of being really holistic, which I don't want to speak for you, but I think also means whole body.
You can speak for me.
Which is why I am just psyched. Everything that I was reading about the pelvic floor and understanding from your practices and everything you're doing, I am just so fascinated to lean in with you today. So thank you for being here.
Absolutely.
So we always start in Off With Your Coat with really like diving in on your personal experience. I would love to know if there was one health challenge for you or experience that you had that aha moment, or just like, how is this what women's healthcare is?
Absolutely. So I was running a sexual and reproductive women's health program at a large medical institution here in Boston. I was doing that. I was 4 years in, and then I was diagnosed with breast cancer.
Oh, wow.
And had horrible pain with sex. And went into surgical menopause because I was BRCA2 positive, and so decided to elect to have my ovaries out. And nobody could really help me.
Yeah. Yeah.
So that was a pivotal moment. It took me a long time to find someone, an incredible nurse practitioner, shout out to her, Kate Nolan, amazing, she changed my life, who did an appropriate pelvic exam, meaning like she checked the muscles and she checked to see if they could release and if they could contract. And she said, "Oh, Kathy, you have really tight pelvic floor muscles." And I said, "What is that?"
Right.
Now,
yeah.
keep in mind, running a women's health program and I doing a lot of gynecological procedures, not knowing about the pelvic floor. So that was my like, oh my gosh, like that was my moment.
That was the holy shit moment.
That was the holy shit moment.
Yeah.
Totally.
Wow.
Yeah.
Why do you think there wasn't any pelvic floor education in all of the, I'm sure, very lengthy education process that you had?
Right. Because it's not, you don't see the pelvic floor muscles. I think that's part of it. I mean, men have pelvic floor muscles too, and we need to consider men. Actually, men are very underserved in this area. I wouldn't say that about a lot of other things.
Right.
With men's health. And we're so focused on the disease process when we do our training. So, for example, when we learn how to do a pelvic exam, we're screening for sexually transmitted infection. We're checking for, are there any ovarian masses? And we're doing a pap smear. Those are all incredibly important things, and you have to do that. And what I always say is there's so much happening on the way to the cervix, and we don't learn about that. We learn head to toe musculoskeletal assessment, but we learn nothing about how to assess the pelvic floor muscles or their motor control, which is their ability to contract and release. So it's in the training. And then you're only, as a clinician, you're only going to assess what you're taught to assess until you come to one of these pivotal moments where you're like, wow, I don't know what to do. Like I'm not truly helping people because I've ignored this entire part.
Mm-hmm. So does an OB-GYN have training in this?
No.
So when you're like postpartum, for example, and you're going in there and they're, I thought, assessing your pelvic floor muscles, are they doing that?
I mean, maybe some of them are, but I think at that point they're seeing, like, do you have strength? Like, can you contract the muscles? I think that's what they're probably looking for. But how many friends, colleagues do you have that tell you about their postpartum check and they don't even do an internal exam?
Right. They're like, oh, you're
good. Like,
now.
they're looking to see, like, have the stitches healed?
Right.
Are they clean? Are they dry? Is there no evidence of infection?
Right.
Again, very focused on the disease process. And that is a baseline that we all have to have as clinicians. And that's not enough.
Yeah.
Because women are more than the disease process. They're whole human beings. And the pelvic floor, the pelvis, is the grand central station of the body.
Right. And how has it been this abyss for so long?
Just an abyss.
Right.
An abyss.
So on that note, going back to breast cancer, first of all, how are you doing now?
Oh, thank you for asking. I'm doing great.
Yeah.
I'm
awesome.
13 years out.
That's amazing.
Yeah.
Oh, that's incredible.
So grateful every day.
Yeah. What was your personal experience when you were sort of the relation? Was it the treatment that you started to have pelvic floor issues? Was it like dryness, pain? Like how did you sort of connect
all of those things, yeah. So probably chemo. I had to do a lot of chemo, and I think that temporarily put me into menopause. So a lot of vaginal dryness, which I had no language for, nor did any provider that I saw
really
have language for. I had a wonderful social worker, because when you get a cancer diagnosis, you get a social worker. And she's like, oh, yes, the pain with sex, that is real. So it was some kind of like Vaseline type of something. I forget what it was.
Yeah.
She goes, just go get a big tub of that and just like slather it on.
Just throw all the petroleum right
And I was like, wow, and this is like at a very large medical institution here in Boston. And I think she was trying to do her best with the education that she had.
Right.
It's a systemic problem. So I had horrible pain with sex, horrible vaginal dryness, and I had no idea what to do.
Yeah.
Yeah.
So how did you advocate for yourself in that time frame to get to the right people to help you?
Yeah. So I just kept trying.
Yeah.
There was I think a 6-month wait to see the gynecologist in the survivorship program at Dana-Farber. I didn't want to wait for 6 months. Right. And I lucked out. And at the gynecological oncology office at Beth Israel, this is where Kate Nolan, the nurse practitioner who did the pelvic exam. And so I lucked out that she said, you have tight pelvic floor muscles. And then she gave me a list of pelvic floor physical therapists, and she said, but you need to go to these ones. And those ones were these wonderful physical therapists who were trained in myofascial release.
Oh. Can you explain myofascial release to me? Because that is something that's been on my radar for a while, and I'm fascinated by it.
For sure, yeah. So myo means muscle, and fascia is the connective tissue. And so the connective tissue surrounds literally everything in the body. So it surrounds muscles, ligaments, tendons, bones, even down to the cellular level, which is an amazing thing. So the analogy I use is if you go to the farmer's market and you get a basket of berries and they're covered in that hairnet kind of a thing.
Like the webbing.
The webbing, yeah. So that's what your fascial system is. And it needs to be well hydrated. It needs to be able to move and support you and stretch, right? Like when you see the net over the berries, it's like protecting them, but it's not squashing them. So what happens for a variety of reasons is that fascial system starts to harden. And when it hardens, it exerts a pressure. And that can create a lot of pain, because what's happening in the body is we're these incredible, living, being, fluid creatures, And we don't walk around saying like, oh, my fascial system is stuck. But that's what happens.
At night when I'm like, to my husband, I'm like, I birthed two babies. I'm like, my fascia, you really need to help me. And he's like, go use your roller. I'm like, absolutely not.
Right. I mean, helpful. But the hands-on part is so helpful. And you can integrate myofascial release into the internal release of the pelvic floor muscles themselves.
So interesting.
Yeah.
So broader strokes with the pelvic floor.
Yeah.
So I was going to read a quote from Wired article that you actually shared today.
Yes. Timely.
Yes.
Yeah.
There are 3 main reasons that no matter how much we ever know about the pelvic floor, it won't make for good party conversation.
Right.
Sex, pee, and poop.
Right.
I had no idea about the poop part, so we'll have to get into that.
Right. Yeah.
So in general, what is the pelvic floor and how does it relate to our overall health?
Oh, totally. It's the grand central station.
Yeah.
So if we're thinking on a more micro level, the pelvic floor supports your urinary, bowel, and sexual health, which is why it will never be conversation at a party. Although once people find out what I do, it often is conversation at a party. But because I love talking about it, so it's, what someone once said to me, the way you talk about the pelvic floor, it's like you're making a peanut butter sandwich. It's just like so matter of fact. I'm like, that's the best compliment ever.
Right.
Yeah. But what else does it do? So it helps to transfer weight load, right? Because it's right in the middle. So if you're thinking from the top down or from the bottom up, it helps to transfer weight load. It helps to support your viscera, your abdominal organs. That's a super important part. It helps, it's very involved in breathing because your pelvic floor and your respiratory diaphragm, your muscle of breathing, work in concert. So when you take a nice deep breath, when you're calm, when you're not in the fight or flight, when you're not stressed out, your respiratory diaphragm descends and drops down and your pelvic floor relaxes. And so when you can't take a deep breath, often your pelvic floor gets stuck. And so we can dive into that later, but that's another thing. So it acts as this beautiful pump really to get more oxygen into your system when that concert is working beautifully, when there's harmony between the respiratory diaphragm and the pelvic floor. It's also incredibly vascular, meaning there's a lot of blood flow through the pelvic floor, which is amazing, right? So it's this incredible lymphatic pump for your whole body.
Yeah.
And that's something that we don't think about a lot.
So meaning it is helping with the circulation with your whole body.
Yes.
It's helping rid toxins.
Yes.
Like all of that.
All of it.
Wow.
Yep.
And I've read that some people describe it, and also that Wired article pointed out that a lot of these diagrams that are floating around the internet are so incorrect.
Yeah.
And so anatomically, someone was saying it's sort of like a bowl at the bottom.
And actually pelvis means basin in Latin. How fabulous is that?
Yeah, I love it.
Yeah.
And going back to what you were saying about the fascia, how it's more flexible.
Yeah.
Is that the same sort of thought process with the pelvic floor? Like, is it malleable to an extent? Okay.
For sure. Yeah.
When I was giving birth to my daughter, so my second child, I was 0 to 60. My water broke. It did not break the first go around. And it was really the first time that outside of thinking about my pelvic floor in my preparations and pregnancy and like thinking about it postpartum to really like knit my abs back together and like make sure in my mind what I was thinking I was doing and sort of pulling everything back together, that I thought about the pelvic floor in a different way because I, again, was 0 to 60. I got to the hospital. I asked the OB and the team if I could use a mirror because I had gotten an epidural.
I love that.
And I was like, I want to see her come out.
Totally.
And I am like laying there and I closed my eyes because I was trying to visualize pushing her out as I was
beautiful.
I thought was the right way to do it, where you're not like actually like some people are like, oh, do it like you're gonna like poop on, which is I think incorrect, right? Like it's you can walk me through that, but different muscles and all of that.
Yeah.
So I was trying not to do that and trying to breathe. And as I was doing that, I see her head, and my son is blonde hair and blue eyes, which I saw him come out, but he looks exactly like my husband. she was coming out, and granted, she's, in all of the things. And so her hair was dark, and I just started giggling. And so as I giggled, my pelvic floor relaxed, and she just started sliding out. And my OB was like, keep giggling, keep giggling. And so now I'm like in a fit of laughter, and she slid out. There's so many communications and people in the way that they try to teach you how to birth or do all those things where it's like the physical pushing versus just the thought of your pelvic floor relaxing. And her coming out and then being birthed in this like fit of laughter and love. It was awesome.
I love that.
Yeah, it was really cool.
Right, because when you laugh, your jaw muscles relax.
Yeah.
And we'll get into it later, but there's an incredible connection between the jaw and the pelvic floor.
Yeah.
Right. I think a lot of birth prep will talk about that, like the horse lip, like the trying to blow your lips like a horse would.
Yeah.
Right. That's to get your pelvic floor muscles to relax.
Yeah.
When I help my patients with birth prep, I bring in the partners and I say, like, make them laugh. Like, what do you have to do to make them to laugh? And that's how you can be most supportive to your the laboring person.
I love that.
Yeah.
What other tips do you have for women that are either pregnant or for like the laboring aspect?
Yeah. So I think it's important if you have access to a pelvic floor therapist, so you can practice the pushing ahead of time. Mainly so that your brain understands the mind-body connection, so that those muscles understand. And it sounds like you probably did some of that. So maybe your mind was already connected to those muscles.
Yeah.
That's super helpful because then you're not going to tense. And then when you're laughing, it's going to exponentially help the muscles to relax. Because there's different kinds of, when you say like bear down, like you're having a bowel movement, that's actually an eccentric contraction, right? We have two kinds of contractions, eccentric and concentric. It gets confusing, but it is in itself, even though it's a lengthening, it's what we call an eccentric contraction.
Okay.
But because you had that mind-body connection, you had peace and stability. So much of the pelvic floor is about finding stability. So once you can find that, then when you're laughing, like I said, it exponentially impacts the ability of those pelvic floor muscles to relax.
Yeah.
So it's so beautiful.
So what you're saying is we probably need a new role in the hospital of like some sort of jester or someone just helping
100%.
us.
Yeah.
Just laugh them out.
Another thing I'll have people do is have their partner, when they come in, is there something like a soft touch of the hand, a soft touch of the foot, even a soft touch to the cheek? Because especially the extremities, right, the hands and the feet, if these are tense, and when you're in labor, you're in pain, right, alternating states of pain.
Yeah.
But there's a lot of times there's involuntary clenching that we don't even realize. And so just a gentle hand from someone that you love will soften the tensing of the feet or the hands. And remember, any tension of the extremities radiates in.
Yeah.
And will make you clench your pelvic floor, which is not what we want when you're laboring.
Interesting.
So that's a big one that I talk about a lot.
Okay. So we'll come back to the pregnancy piece.
Yeah.
But I think let's go back to the thought of clenching.
Yeah.
And literally clenching with your jaw,
Yeah,
because the jaw-pelvic connection is something that I started to think about from you, because I have TMJ. I clench consistently. But is it the jaw then that is radiating to your pelvis, or is it your pelvis causing your jaw
That's
to
a
clench?
beautiful question, and I don't know the answer because they're so intimately connected.
Yeah.
Because the spinal column is the beautiful highway between the cranial cavity, the head, which houses the TMJ muscles, and your pelvic cavity, which houses your pelvic floor muscles. So I'm not sure which one begets.
Right.
But you have to address them both.
Right.
So for some patients that I see where I'm not able to do an internal exam because the muscles are so tight, I will often start with working on the jaw and going intra-orally, meaning with a gloved finger going inside the mouth and releasing the tension in the mouth.
Yeah.
And as we start to do that, it will often help with the pelvic floor.
Interesting. And helping the pelvic floor, meaning someone, so for listeners who don't know, they're feeling pain in their jaw and their pelvis, for example, like, and that's something that you'll go in and start with that process.
Absolutely. Or patients that can't tolerate internal exams, meaning the muscles just involuntarily spasm. It's a condition we call vaginismus.
Yeah.
And so, a young person who wants to have a pelvic exam but can't because of that involuntary clenching comes to me so that her goal is to have a pelvic exam or eventually like have something inside, penetrative activity of some kind.
Wow.
You start with the jaw.
So even if they don't have TMJ or jaw pains, you can still enter that area through the mouth and through the jaw.
Exactly, because they're intimately connected. You have this beautiful, think about it like a casing that goes around your skull. It's called dura mater, right? So you've got this beautiful casing that goes around your skull. It exits at the base of the skull, and then it creates like a dural tube. Just think about it like a tube that surrounds the spinal column, and the end is at the coccyx or the tailbone, which sits in the pelvic floor.
Oh, wow.
How cool is that?
Yeah.
Right? And yeah.
Another thing I have to ask my husband, you got to massage my jaw at night.
Totally. And then the other thing that people don't think about, but that is so important, is that when there's too much tension in that dural tube, or it impacts the ability of that cerebrospinal fluid, right? So we think about the circulatory system, the heart and the lungs, and everybody's super familiar with like the big oblong circle, right? So you have one, it's a lot skinnier. Think about this tube, the spinal column. You have cerebrospinal fluid that flows from the head to the pelvis.
Yeah.
And like, we don't walk around saying, "Oh, my cerebrospinal fluid rhythm is off." No, people would look at you like that's not common. But like, I don't feel right. Like, I feel on edge. I feel not quite like myself, or what. It has such a huge impact. That's why modalities like craniosacral therapy are so helpful, and I incorporate that into my work.
Yeah.
Because you have to rebalance that fluid.
Yeah.
In order to it's all about, we got to bring stability so that you feel safe. And then you can start to heal, right?
Yeah.
But you have to feel stable first.
So is much of your nervous system living in the pelvic floor?
I mean,
all of it.
Your nervous system is key. Yes. It's in every fiber of your being, right? Like that upregulate. I talk about upregulation a lot, or being in the fight or flight, or being in your sympathetic nervous system.
Right.
And it's very hard to feel better or to work on anything, any kind of health issue, when you're so upregulated all the time. So again, we don't say like part of that upregulation is my cerebrospinal fluid rhythm is off. We don't say that, but that's part of what is happening.
Yeah. So as you were imagining this practice that you're in now, and I know because you're a nurse practitioner and you have a PT that works alongside you, and you're bringing in all of these other modalities, which we talked about is so important to GenWell, and just exposing women to not just one point of view on their health, because it is so important to bring in all that education and different things that we could do with trial and error. Yeah.
And trial and error, absolutely.
Because our bioindividuality can be assessed so differently. And so I love that you're taking that approach.
Yeah.
Another question for you for the pelvic floor is, how does that then relate to hormone health and sexual health?
Excellent question. So you need to have optimal hormone health on a local level. So when I say local, I mean like we're talking about the muscles and tissues of the pelvic floor, for those muscles to function optimally. The pelvic floor needs estrogen, and the vulva, the tissue in between the labia minora, it's called your vulvar vestibule, needs estrogen and androgens, which is testosterone, in order for it to do all the things that it needs to do, in order for you not to be incontinent of urine or stool, in order for you to have an orgasm, in order for you to keep all your organs up so that they don't, you don't have pelvic organ prolapse.
Yeah.
So it's like you need to, as women, right? Like there's so much new research, which I love coming out about like women need to eat protein before they work out, right? Amazing. You got to hydrate and you got to make sure you eat. Well, you have to make sure that the hormone levels of your pelvic floor for the tissue health is optimized so that you can do all the things that the pelvic floor does.
So how do you do that?
Assessment.
Yeah.
So you don't need to do any kind of lab work or anything. It's all on the outside for the vulva. You look. You have to look at the vulva. You have to look at the tissue in between the labia minora, and you have to look at the clitoris. It's a complex. It's a hood and the glands.
Okay.
And so you need to make sure that clitoral hood is moving appropriately, meaning like it's not stuck, because it can get stuck.
What does that look like?
Oh my God, it just doesn't move. And you're looking for dryness.
When is it moving?
Oh,
when you're...
So the clitoris...
Yeah, tell me.
Yeah, the clitoris, and if it's helpful, the clitoris and the penis are homologs. They start the same as an embryo. They differentiate at 4 weeks.
Okay, yeah.
So for those people that have a partner or a child with foreskin, right? Like the foreskin retracts.
Right.
So that's the same as the glands of the clitoris.
Got it, okay.
And the hood of the clitoris.
Okay.
And it needs to fully retract both up and down, and then it needs to move side to side. And if it's dry, hard to do that. Sometimes things get stuck under it.
Okay.
And that impacts its ability to move. And we want to make sure it's moving optimally so that if you want to try to have an orgasm, you can. Because if it's stuck, you're going to have a harder time having an orgasm.
Interesting.
Yeah.
Is that because, TikTok and everyone is going to tell these women, go test your clitoris and see if your hood is moving appropriately. So what can you tell women to say, for the sexual health piece, if you're having trouble orgasming or...
Get a mirror. Wash your hands.
Okay.
And then move the hood up and down and see if it moves easily.
Okay. And then if it doesn't,
then
going to
go to see your clinician.
Okay.
I actually have I forget the name of it, like a handout for patients. It's like your optimal clitoral health, like your checklist for your provider.
Yeah.
Right. Happy to share that if that's helpful. And it's like, look, does the hood move? Does it seem dry? Do you have any pain? Do you have anything stuck under the hood?
Right.
I can't remember exactly.
Which is so interesting because that's the first time I'm hearing this. And I've had so many friends that can't achieve an orgasm.
Right.
By themselves or with a partner.
Totally.
Or what have you. So it's just so interesting. Yeah.
I mean, orgasm is complex. And the first thing that you have to think about is anatomically. So that's why you want to look at the hood.
Yeah.
The other thing is that if you look on the back side of the clitoris, like internally, the clitoris has legs.
Okay.
I wish I had I have a crocheted clitoris. I'll send you a picture.
Oh, yeah.
I don't have it with me.
I would love to see the crocheted
it's
clitoris.
Amazing.
Thank you.
I will send it to you. So it has legs. And the legs, think about your vagina like a tube. The legs wrap around the tube. So as we get aroused, there's this beautiful choreography that starts to happen. The legs fill with blood. They engorge.
Yeah.
That engorgement and then the contraction of the tube of the vagina, which is essentially, you're talking about your pelvic floor muscles. There's this beautiful choreography that has to happen.
Okay.
Right? So if you have tight pelvic floor muscles, that's going to impact that very much because you need a partner. You need the pelvic floor muscles to be the partner as the clitoral legs get engorged.
So they need to be relaxed, the pelvic floor
muscles. So they need to be flexible.
Got it.
So that they can contract in conjunction with the engorgement of those clitoral legs. And then you have to make sure you've got full mobility of your clitoral hood.
So someone comes to you and they don't have the mobility.
Yep.
How do you work with them on that?
Right. So there's a lot of self-mobilization that you can do. If you're comfortable, I'll have people stand in the shower, let the shower head face them, and then they can move it up and down themselves.
Okay.
I will often prescribe some local hormone therapy, which is usually estrogen, estradiol. There are 4 kinds of estrogen. Estradiol is the one we see most commonly.
Yeah.
E2 or estradiol, and I'll prescribe estradiol with a little bit of testosterone. And then they will massage it onto the clitoral hood and move it up and down and side to side.
So that gives it more flexibility or mobility.
And hope to we want to get it unstuck.
Got it.
And then I'm always like, let's try very conservatively, because usually that works beautifully.
Yeah.
So you try that for 8, 12 weeks. And if like there's just no movement.
Yeah.
And that, usually there's movement. But if there's no movement, or if there are things that are just stuck under there that aren't coming out, there's a procedure that you can do to unstick the hood.
Yeah. Okay, that's helpful. I feel like
Super
that
helpful.
there's so much stigma around sexual health
totally.
for women in general. So even just things like that where some women are just like, okay, well then I won't have an orgasm or
Absolutely not.
Right. So
Sexual health is health.
it's health.
It's women's
so
health.
important.
It's health. It's
yeah.
It's it's, talking about longevity, aging well, like sexual health is a big part of that.
Yeah. So the hormone, because, hormone therapy is on everyone's minds right
Yes, of
now with the
course,
black
yes.
box lifting. And,
Yay.
However, are you prescribing that, like, if a woman is obviously not in menopause, perimenopause, you would still give her those hormones for, like, if it's for the clitoris or if it's something else, right?
Yeah.
Like, is there an age range that
Not at all.
It doesn't matter?
It really
Yeah.
depends. So
Okay.
there's the systemic hormone therapy, which is a patch, a spray, a ring maybe, and a pill. Like those are sort of all that systemic, meaning goes through your whole body. What we're talking about right now is local.
Yeah.
So that means it's, if any, like once you do your visual assessment, it doesn't matter how old the person is. If they're deficient,
Yeah.
and you can tell because the tissue will be very dry, it will often be painful to the touch. You start them on local hormone therapy.
Yeah.
Yeah.
Okay.
And then another big thing is that when you have dryness on the outside, like on the vulva, it causes tightening on the inside. It's like we live in Boston, you go outside on a day like today
Yeah.
without your moisturizing cream on, and your face feels like it's being pulled.
Yeah.
So that is, the face being pulled is analogous to your pelvic floor muscles contracting, shortening, and tightening. That's why
Yeah.
you can't have a dry vulva.
How do you moisturize your vulva?
Right. So
outside of the hormones.
Right.
Yes.
So,
Yeah.
I mean, the gold standard is
Yeah.
the hormones, but not everybody wants to do hormones. So there are a lot of nice moisturizers on the market. You got to be careful. You got to read I'm super passionate about the
Yeah.
ingredients. You don't want to like disrupt your vaginal microbiome. It's a whole thing.
Yeah.
But there are companies that have made clean, pH balanced, appropriate products for that tissue.
Yeah.
Yeah.
It's not the same as lube. This is a
No, that's
totally
an excellent
different product.
question.
Okay.
Moisturizing is like moisturizing your face,
Yeah.
right? Like it's mucous membranes.
Right.
You want to moisturize them.
Yeah.
Lube is to help with friction.
Okay.
And we all need lube. We all need lube.
I forgot to bring mine because I was going to get your opinion about
yes.
it. So I'll
What
have
is
to
it?
email. It's a coconut based.
Okay.
It's like organic coconut
Yeah,
oil and it
okay.
has a little vitamin E in it.
Oh, perfect. Love that. I'd be happy to
Okay.
look at it.
Yeah.
I'm super
There's
passionate
nothing else
about
in
lube.
it.
Oh, great. Okay.
So, but maybe you want to try this one.
yeah, because lube is, everyone needs it.
Okay. Yeah. Tell me.
People, there's a real thing. A lot of my patients will say, I don't need it. I'm like, yes, with all due respect, you do, because there's some weird cultural thing about like,
Right.
I shouldn't, as a woman, like I shouldn't have to need it. And
Yeah.
that's just simply not true. It's going to be much more comfortable.
Yeah.
And so we need to break that stigma
'cause,
around
like,
the lube.
the marketing with like KY and all
Yes.
this shit where it's
And
just like
KY is
cheap and gross.
Toxic.
Yeah.
Okay, so this is the thing that makes me insane. And if men had dry penises or needed
Oh, yeah.
lube, that we would not have this issue. Every bottle of lubricant that is sold should tell you what the pH is.
Okay.
And there's another thing that they should put on there. It's called osmolality.
Okay.
it's
I'm
not
not going to
important.
guess what that means, but tell me.
It's only for water-based lubes.
Okay.
And we want to make sure that it's not too high, because when it's too high, that osmolality, it sucks the moisture out of the vagina and sloughs off the first layer of vaginal epithelium and can cause micro tears in the vagina.
Oh, sweet Jesus. Yeah, we don't
So
want that.
things like KY jelly, things like Astroglide, they are, and we have, the research has given us, the World Health Organization has actually given us the upper threshold. So we know what that is.
Yeah.
And Astroglide, KY, anything that's like warming or cooling or smells is all way above that threshold. So that osmolality and the pH should be on every bottle of lubricant that's sold. And if it were a penis issue,
oh, yeah.
it would be on
And
there.
it'd be half the price.
Totally. Totally.
So what about condoms then that have lube on them? Are there any condoms?
There are a couple. Yes. So they're lambskin ones.
Okay.
I think the brand is it's SKYN Skin, I think.
Okay.
There's a company called Lilo. They make really nice, they make beautiful vibrators, and they also make condoms. They're Lilo Hex, and that's a brand that doesn't have, I think, all that toxic stuff on them. And I think, they're more and more, if you, like last time I Googled, because I'm always looking for new options for people, like clean, non-toxic condom, but you do have to do your research.
Yeah. So what, we're like an anti-fragrance team over here with like our Wealth Collective, products and all of that.
Yeah.
So outside of fragrance, are there any other ingredients that if you see that on a bottle, like do not use this lube, do not use this moisturizer?
Yeah. So everyone has a different threshold, right? I don't do petroleum products, parabens, things like that.
Yeah.
And I look for as few ingredients as possible.
Yeah. What pH level are you looking for with the moisturizer?
So anything less than 4.5.
Okay.
But again, you have to dig to find that.
Yeah.
It's not like readily available, which is problematic.
All right.
And so we're talking about, I just want to go back to the lube for a second, just to clarify. So that osmolality that we were talking about, like the sloughing off the first layer of the skin of the vagina, you only have to worry about it for water-based lubricants.
Okay.
Because
so what's the
there are
alternative?
3 kinds of lubricants. There's water-based, so that's where we really worry about that one. And then there's silicone. You don't have to worry about it. It's not going to be an issue. And then there's oil-based. The caveat with oil-based lubricants is they don't work with condoms.
Because why?
It renders it useless.
Okay,
So we don't want that, and that's a huge, because
everyone's going off with birth control because TikTok's telling them to.
Totally.
So
and I
that's
mean,
great. Yeah.
I am so passionate that people have ultimate reproductive control and that you plan if and when you want to have a pregnancy, and it's not because you used a condom with an oil-based lube.
Yeah. Okay, that's super important. Thank you for that.
So just to clarify.
Going back to the broader pelvic health for a moment. So we started talking about this because I'm going to come see you, and I'm so excited because I personally have had a ton of lower back pain, and like with my first child, I had an epidural, and they actually were like, oh, the bottom of your spine is curved. And so I don't know if it was from dancing my whole life, but I might have like a curvature and scoliosis from dance.
Yeah.
I don't know if that's contributing to it,
Right.
but you were like, oh, you might have a tight pelvic floor because of dancing, which is very interesting because even as I'm speaking with you now, I find that not that I'm holding my breath, but my breath is very shallow, and it feels like I'm doing a Kegel as I sit always.
Yeah.
So how do you know if your pelvic floor is tight? How do you know if it is loose or stretched out or whatever else it could be?
Yeah.
And where do I go to assess all of this?
Right. So I think Those are all such good questions. I think ideally, if you can go to a pelvic floor specialist, whether it's a nurse practitioner like me, a PT, OTs now do pelvic floor. One of my colleagues is an OT.
Great.
Yeah, which is awesome. Someone who can assess the pelvic floor muscles, because then you'll know if you're like constantly in a Kegel, or so you have high tone, normal tone, and low tone, just like any other muscle in the body.
Okay.
So if someone can assess that, and then you need to know, can the muscles contract and can they release? That's really the key things that you need. Those are the key things you need to get assessed.
So is having a tight pelvic floor, is that a dysfunction, or is it leading to dysfunction?
It's so hard to say.
Yeah.
I'm not sure. I think in terms of, it might be okay. And then I think for the long term, you want to make sure that the muscles can also relax. You don't want them always in a state of tension. Because eventually they're going to get tired.
Yeah. I feel that.
Yeah. Eventually they're going to get tired.
So is it something, in your opinion, that women should be doing annually, biannually, where they're getting their pelvic floors checked?
Wouldn't that be amazing?
Right.
Yes.
Should that be happening
Before.
when we're teenagers?
Yes.
Like, at what stage do you think that this should be implemented?
I mean, as soon as you can.
Yeah.
In an ideal world,
Yeah.
it would be, you turn 16 if you're able to tolerate a pelvic exam, and then you learn, what is the tone of my pelvic floor muscles? Can they contract and can they release?
Right. Because I keep talking to all of these professionals about just establishing a baseline for yourself. We have no education or knowledge on our bodies, let alone a baseline for health.
That's right.
And if this is Grand Central Station and connected to everything, I feel like that should be imperative. And selfishly, a lot of what I'm doing for my brand is like, how can I give my daughter, who's almost 2,
Totally.
this lifelong understanding.
And your son.
And my son, too.
Because
you're
men
right.
have pelvic floors, too, right?
Right. No, that's fair.
Yeah.
Just better anatomical understanding, or understanding of like, oh, this is a little bit off, and I can get ahead of things and be proactive versus reactive to all of these things.
Right. Because I see all the people all of my patients are people that they've let it for many different reasons, either not wanting to go and seek help, or I see a lot of people who have seen like 10 providers and they're like, I don't know. So they order. People come to me with like having had 15 pelvic ultrasounds, 10 urinalysis or urine studies. They've been treated for yeast. They've been treated for BV, like all these vaginitis kind of infections that they don't have.
Oh, wow.
Yeah.
So how is it misdiagnosed in those scenarios, or they're just kind of throwing things at the wall?
I think they're throwing things at the wall. And when people come in, your patient comes in and they say, it burns when I pee. You have to do a urinalysis. That's in the office. You dip their urine and you see. And then if it's positive, you send it out for a urine culture because you want to see if it grows out anything so that you'll know what to treat for. Like you pick the appropriate antibiotic. Yeah. And then sometimes it comes back, all of it's negative. But we were taught, and I'm not saying it's wrong, but I think there was just more, like they kind of didn't teach us enough. Because what happens is that we're taught to empirically treat, right? Meaning somebody your patient can call on the phone and say they have all these symptoms. You treat empirically. You just prescribe them antibiotics.
Right. You treat the symptoms individually in a vacuum.
Right. Exactly. Yeah. So then, but then let's say they were in the office and you did the urine test and it all came back negative. Well, they've just now completed a course of antibiotics.
Right.
Some of the antibiotics, they'll feel a little bit better because they have inherent anti-inflammatory properties to them. So they'll feel a little bit better, especially with men and prostatitis. That's a big one.
What is prostatitis?
Inflammation of the prostate.
Okay.
Right. So, but then they're on your schedule. That same person with the burning with urination is back to see you in 2 weeks later, same symptoms. And and I never learned this. And when I did, I was like, oh my goodness, how did I not know this? When your pelvic floor muscles are super tight, they can compress or irritate the nerves of the pelvic floor. And when those nerves get irritated or compressed, they cause symptoms like urinary urgency, urinary frequency, burning. They can cause sweating. They can cause a rash, and they can cause vaginal discharge.
Wow.
All the things that look like a urinary tract infection or a vaginal infection.
Yeah.
So I'm not saying like
Wow.
you have to do your due diligence. You have to rule out an infection 1,000%. And the missing piece is that when your patient comes to you with those symptoms, you're not checking their pelvic floor muscles.
Right.
And that, to
That's
me,
the
is the
missing
missing
piece.
piece.
Yeah. Oh, that's so fascinating.
Yeah.
So if, I were going for a UTI and like my culture came back negative,
Yeah.
but they're still giving me an antibiotic because they're like, well, we'll just treat it.
Well, because you don't know,
treat
right?
it.
Because by the time, if you don't treat it,
Yeah.
the worry is that the infection will go up into the tubes, right?
In your kidneys
Exactly.
and-
And
okay.
go all the way up to your kidneys.
Yeah.
And then we all worry
Right.
about that. So,
Right.
but if you it's for the person that keeps coming back. Like the first
The
time.
recurrent
it's the
UTIs or
recurrent
UTIs, yeah.
UTI-like symptoms.
Oh, interesting.
That's the big one. And the recurrent vaginitis type symptoms.
Which is discharge.
Discharge, a rash, things like that.
Oh, that's so interesting.
Yeah.
So the inside out.
And again, but it's a black box.
Yeah. God. So what are some of the other symptoms that you see women coming to you with? A big one is prolapse. But that is because of loose.
So prolapse is interesting because it can be both weakness and then sometimes the muscles can be tight and weak.
Interesting.
Yeah.
And what is prolapse for those who don't know?
Oh, right, of course. So prolapse is when the pelvic organs, so we're talking about the bladder, the uterus, and the rectum, they need connective tissue support to keep them all up.
Because they're in that bowl.
They're in the bowl.
Okay.
And then without the connective tissue support, they sometimes can fall down in different stages. So once I had a patient who had to see me, she's like, oh my God, like something has fallen out of me.
Oh, God.
It was
it did.
prolapse, right?
Yeah.
Right. And it was
Right.
pretty significant prolapse. And I'm sure it had been there. It doesn't just happen, right? Like it happens in stages, and maybe she hadn't noticed it before.
Right. So it's almost like a hernia,
Kind of.
So this is a silly question,
No,
but you
there's not.
see the organ like
Sometimes,
protruding
depending.
out?
They're different stages.
Oh, my God.
So sometimes, for example, when you spread the labia apart and you're looking at the opening of the vagina, you'll see like a little bit of the rectum poking out.
Oh, wow.
Sometimes
Yeah.
you'll see a lot of the rectum coming out. So we have stages.
Yeah.
We grade it.
I mean, we're just conditioned to be
But
okay with pain.
Oh, totally. I mean, because what it is it's all we talk to patients and we say, well, this is normal. It's not normal. It's common. It is not normal. There's nothing normal about it. And that's where like the role of hormones for connective tissue support is like really helpful.
Right.
Right.
And our hormones are up and down our entire lives. So I can understand how, especially for us, yes, men
Totally.
have hormones and they have
Yeah.
pelvic floors, but for
Yes.
us, there's so much happening
Totally.
across our lifespan that can affect it.
Oh my gosh! Like any time where there's a big hormonal shift.
Yeah.
Postpartum, if you're breastfeeding, you are hypoestrogenic, right?
Oh,
That
God.
means
Yeah, tell me
low
more.
estrogen.
Yeah.
That estrogen is a big player in the health of the vulva and the vagina. So that's why, like so many people postpartum will talk about, they'll have urinary complaints, they'll have pain with sex, they'll have all these things that maybe they didn't have before.
Low libido.
Low libido. Oh, huge.
Yeah.
Because they're hypoestrogenic, right? Perimenopause, you've got hormone chaos, right? So you've got estrogen levels, progesterone levels fluctuating wildly, and that has a big impact on the tissue. And then you have menopause, which has a big impact on the tissue because then all your levels are very low. anytime you're on any kind of hormone modifying
Yeah.
medication, like a selective estrogen receptor modulator for breast cancer patients with hormone receptor positive cancers, that's a big one. So
Yeah.
anytime anybody's on any kind of hormone modifying medication, that's when you need to do an assessment, look at the health of the tissue, the vulva, the vagina, and do an assessment and see how the pelvic floor muscles are working.
Yeah.
Because you can support these patients with local hormone therapy. Local hormone therapy with estrogen and testosterone is safe for everybody.
Well, question about that for the nuance. So
Yeah.
breastfeeding. So I am still breastfeeding. I've been trying to wean since April. I like to say my daughter has my jaw, which is a little bit smaller, and my husband's giant teeth. So she was teething for a very long time. So it was
yeah.
just very soothing. But I am
Yeah.
like, I definitely have a low libido.
Yeah.
I feel, mood-wise that my estrogen is very low.
Yep.
For sure.
Because you're breastfeeding.
Because I'm breastfeeding.
Mm-hmm.
So is that something that can be treated with hormones? Or obviously it's more of a blip when you're breastfeeding.
Right. So,
But,
and we would
yeah.
think about local hormones for
Yeah.
you when you're breastfeeding. By local, I mean directly applied to the vulva and vagina, because you have almost no systemic absorption.
Right.
Now,
And
the
then-
other thing I would say
Yeah.
is it's interesting because we don't routinely think about giving hormone therapy to women that are breastfeeding. However, and I'm not writing the guidelines on this, but what I want people to think about is, what are your hormone levels when you're pregnant, when you are growing that
Oh, yeah.
baby inside of you?
Right.
Just saying.
Right.
So I'm not sure
Right.
there's a big disconnect for me about why we're not. Your hormone levels are dramatically increased during pregnancy.
Yeah. You mean the fear
The fear of
doing
giving someone
hormones. Yeah.
hormones. Now,
Right.
I also would say, once the breastfeeding is well established, no one worries about putting a postpartum woman on a combined oral contraceptive pill, which is both synthetic estrogen and synthetic progesterone. Nobody worried. No, that's fine.
Right.
But yet there's this big, no person land
Yeah.
when it comes to what we call menopausal hormone therapy. It's really hormone therapy.
Yeah.
It's not,
Right.
the name is not.
Right.
So it's an interesting question that I have.
Yeah. Or just reframing hormone therapy in general, because birth control
Totally.
is a form of
Hormone therapy approved by the FDA.
Right. Right.
And I don't remember the exact amount, but the amount of hormones in hormone therapy is so much less than what's in the
Right.
combined oral contraceptive
I was
pill.
just talking to someone about
right.
that.
So it's kind
Yeah.
of crazy.
Right. Thinking about, and again, it is interesting because social media is so prevalent and it is shaping a lot of, especially Gen Z, they're
Right.
going exclusively to social media for health content. And
That's
that's
why
why.
it's awesome that you have that wonderful, the person you work with at Penn, the
Oh,
researcher.
Emily Fender. We love Emily.
Thank God you have her.
She's amazing.
She is.
Yeah.
Yeah.
It just having, or voices like you, that's why Jen, we are in social media, we are trying to do more experiential so women can connect in person.
Yeah.
But I think we're going to be going on social media. That's
have
where
to.
the voices are, but we need more of the right voices to be there.
Right.
Emily actually said in one of her studies about, it was for preeclampsia, that the majority of the misinformation circulating was actually coming from MDs.
Yeah.
Which is quite terrifying.
It is.
Because they're either knowingly circulating misinformation
Right.
to get views, to get followers,
Right.
or there's just, to your point, this general lack of education in some areas.
Right. I think the statistics, the most recent ones, I think clinicians get maybe an hour
Yeah.
of hormone therapy education. And I think, to go back to an earlier question that you had, I think if you learn about the pelvic floor in your training, it's only to do Kegels. There's nothing else.
Right. And for sex, not for your own health. that's like the thing, or and you're sort of possibly to not, pee when you're laughing 20 years postpartum or whatever else.
Right.
So let's go back to the postpartum piece as well. Why isn't it just a regulation or mandatory? You knew exactly what I was going to say.
Yeah.
To have pelvic floor care for women, like, preparation during pregnancy and postpartum in the U.S.
I don't know. It's shocking.
I mean,
it's shocking.
Other countries, it is part of their,
totally.
The UK, France. It's just
even China. I had a patient once. She was from mainland China, living in Boston for a while, and she had one of her kids there, and I was helping her after postpartum with her second, and she was like, I had somebody who came in the hospital and like assessed my pelvic floor. I was like, wow. And then she had somebody, I think, that did a home visit for her.
Yeah. I mean, we're struggling in the U.S. to get a lactation consultant to come to our homes.
Right.
So it's like, we need to start building this tribe of people around us for our health.
Yes.
And it's sounding like the pelvic floor needs to be front and center of 100%. That conversation. All right. So we're doing proactive care. We're going to be doing this. Trying to see someone at least once a year. If you're not, are there certain stages of your life where you should be seeing a pelvic floor therapist more outside of just postpartum?
For sure. So I think if you are having any kind of urinary issues, frequency, urgency, leaking, you should go to see a pelvic floor person. If you have constipation.
Yeah. So let's dive in here, because
would love to.
What percentage of the women that are coming to you are constipated?
Oh, remember, I'm skewed. My perception is skewed. Oh, more than half.
Yeah. I mean, every single one of my friends is constipated. And I like to see a functional medicine practitioner, and I also have, my traditional doctors.
Yeah.
So I've done, a gut reset.
Great.
And all these wonderful things that have helped me. But then inevitably, your system is knocked down, or you have whatever else it is.
Yeah.
How do you know to go to a pelvic floor therapist or to get that type of support versus assessing your gut? At what point are you like, okay, this isn't working, or should it be working in conjunction?
I think it should be working in conjunction. And my dream is that when you go to your PCP and you say you're constipated, like we learn, increase fiber, increase water, give them some Metamucil, give them some Miralax, or, And my dream is like, no. Assess your pelvic floor, and then talk about toileting mechanics. Talk about using a squatty potty.
Oh, I love a squatty potty.
Right?
Yes.
Yeah. Get whatever you can do to get your knees higher than your hips will mechanically make it easier to pass the stool.
Yeah.
That's why squatty potty works.
I have the one that folds down.
Oh, perfect. Yeah. And
so it's
just super flat, and you can put it in your suitcase.
It just means the whole house knows what's happening, because it's like
amazing.
And you're ready to go.
You can use yoga blocks. You can use a book. It doesn't great. If you want to get the squatty potty, amazing.
Yeah,
but you can DIY it. All my pregnant patients, we talk about that, like their first bowel movement in the hospital. So I'm like, empty out the trash, put your knees up, put your feet up on the trash can.
Yeah. Perfect.
And we don't learn that. That is why that is my dream. That will be part of the primary care or any kind of internal medicine, because everyone deals with constipation.
Do you have any merch? Because you could do a branded squatty potty.
It's a great idea. I don't have merch, but I co-founded this Institute for Pelvic Health to teach clinicians how to assess pelvic floor motor control and muscle tone, and to even connect the dots that if your patient is constipated, they might have overactive or tight pelvic floor muscles. And here's what you can do.
So the Institute is only for clinicians, but women can go there to also educate themselves.
Oh, for sure. Yeah.
What types of doctors are you seeing, come
enroll.
to you?
So we have a pelvic floor foundations course. So we have many different entry points. We have a YouTube channel where we talk about all this stuff. I co-founded it with a wonderful pelvic floor physical therapy colleague of mine. She's wonderful. And so we have the YouTube channel, we have a newsletter, and then we have this it's pelvic floor foundations, redefining your pelvic exam.
Cool.
Because the point is, you're doing a pelvic exam. So you're already doing it. We're not going to add. We're not overwhelming. We know. Like, I used to do primary care.
Yeah.
You're overwhelmed. I completely understand.
Right.
And you're already doing the exam. So here are some simple things where you can assess the muscle tone and the motor control. And you can help your patient then.
That's
Not
so
like,
incredible.
I'm going to make a referral, and then you're going to have to wait 6 months for the referral.
Right. Here's how to actually make a difference.
Here's how to make a difference right then. If you are referring your patient to pelvic floor PT, if you've done the exam, there's always this like aha moment where you're like, oh, wow, like I want you to bear down, like like you're having a bowel movement and your muscles are actually contracting. Patients are like, what? Right. You get a lot of buy-in, and then your patient's much more likely to go to pelvic floor PT. A lot of patients don't have access, to those kinds of resources. So, again, it's my dream that the first time you see somebody with that concern, and it's usually your PCP, they know what to do.
Yeah.
And so we give them, like, the education that it's taken me all these years to put together.
Yeah.
And it's like, here it is. It's going to actually save you time and make your life so much better, because these patients are going to feel better. They're not going to be back on your schedule with the same complaint.
Yeah. Going back to the patient in that equation.
Yeah.
So I always like to say to women, because we're sort of parallel pathing in the state of women's health right now. We have amazing women like you that are helping to aid in this knowledge share with clinicians. And we as women are trying to learn at the same time, and we're also being inundated with all of this misinformation and confusion. And so I think resources like you, for us even to understand and listen to some of those videos on how you're communicating to clinicians, there is a way for us to use that information to help empower ourselves.
Absolutely.
When with doctors. And especially, I do think we need to take more responsibility for our health as women, and not just, yes, gaslighting is horrible and it happens and it is so frustrating. But we also need to keep pushing back.
You need to be the CEO, right? That's a common thing that people in our space are saying. You have to be the CEO of your own health if you're in a privileged position where you can be.
Right. So come to the appointments with your own questions, but also like pushing back a little and saying, hey, I actually was learning about this. Can you check this? Granted,
with
they're not going to know.
Your clitoris checklist.
Right. Yes. Yes,
yeah,
print it out.
Totally. I have a wonderful virtual assistant. She's like, make me some videos. I'm not with the social media. It's like not my thing.
Yeah.
And so anyway, I made a video about the size of your speculum.
Yes.
That thing went viral.
Yeah.
It was so funny, right? And it was like a public service announcement, because people didn't realize that there were different sizes.
I didn't learn that until your TikTok either.
Right? So, like, what an amazing thing. So if your provider, like, if you're like, oh, could you use the extra small speculum? And if they don't have it, just say, well, I'll be back when you do. Like, footrests. You don't need to use the footrests. No reason.
So tell me about that. So you can use other positions so it's more comfortable.
Yes. That,
whether
they
you're
call
at the
it
OB
the
or
lithotomy position.
Lithotomy.
That's the
where you're in the stirrups and you're scooching down.
Yes, the scooching down and the
Right.
Okay, you can do every single gynecological procedure except when you're doing a colposcopy, because I used to do those. So painful.
I had one. Yep.
I'm so sorry.
Oof.
So that's where, for everybody listening, that's where you have to look at the cervix. If you have an abnormal pap, and you have to look at the cervix under magnification, and you really have I tried to do, so I used to run the abnormal PAP program at the health center where I worked.
Yeah.
So I tried to do those colposcopies without the footrests. I couldn't ever quite figure it out.
Yeah.
But I put in IUDs. I did pap smears. I checked for STIs. I did endometrial biopsies, pelvic exams, everything, no footrest needed.
Actually, now that you think of it, so my favorite OB in the whole world, and she's in New York, she put in my IUD, and I remember her saying this very vividly. She was like, oops, I got the string a little short. I was like, oh, fuck, that'll come back to haunt me.
Maybe not.
Well, no.
Did it?
So I moved to Boston. I came here.
Okay.
I went to a practice, and one nurse practitioner and a doctor had come in, and they're like, we can't get it out. We're going to have to give you, I forget what the procedure is called, to hysteroscopy.
Oh,
is that what it's called? They have to like basically inflate your uterus.
And to be able to take out your IUD?
I might be making this up. I don't remember what it was called.
Because usually would give you like a cervical softener maybe so that we could go in and there's like IUD hooks that you go in to fish it out. It's unpleasant.
Yeah, no, they were saying some sort of whatever it was. I was like, we need to try again. We need to find someone else. So she actually took me out of the stirrups, this next gal. She happened to be a New Yorker as well. So I was like, she's going to do it. She's just going to get in right in there. And she did. She had my legs back, like pulled back versus like in the stirrups.
Totally.
I can't do that without touching my legs. So there we are.
Yeah, no, I understand.
But that's an amazing piece of advice to tell women is don't be afraid of your doctors. You can push back on them. It's your body.
That's right. That's right. That's absolutely right. And you can see someone else.
Right.
There's that hierarchy. We don't have all the answers.
Right.
The nurse practitioners and the doctors, we don't have all the answers.
And the amount of I've never experienced the pain when, with a pap smear or any of that, but I know that a tremendous amount of women are uncomfortable or especially with a speculum have pain. And so that's amazing that you're able to deliver that information to women that there are different how many different sizes are there?
I think in the video, I only had 3 in my office. I have extra small, small, and medium. I think there's also a large and an extra large.
So doctors are just looking at the vagina and saying this would suit you, or they're just generally using one size?
No, I think there's like one size that maybe smalls or mediums. Like when I first started at my institution with my first job, we just had like 2 sizes. I didn't even know there was an extra small. And then I learned and I was like, oh, we got to order the extra small.
And does it matter if it's metal? Because the metal ones can be super cold.
Totally. Yeah, no, but it doesn't. It's really whatever. There's no difference at all. Yeah.
The net is you can ask for accommodations.
That's right. And if your provider's like, I don't have that, say, well, could you order one? Like what I'll do for my patients is I keep them in the office. I will, because I have a lot of patients that come to me and their goal is to be able to have a pelvic exam or speculum exam. So I give them the extra small speculum so they can practice at home. Right? Because you can also say, oh, could I put the speculum in?
Okay.
Because there's no reason, if you're comfortable, and it might be more comfortable for you, right? Yeah. And then, like, you don't have to use the footrest and all those things. And then if they're not willing to do that, your provider, go see someone else.
Yeah. Are there any other tips that you would give women just in terms of finding providers or...
Oh, I wish.
It's hard.
It's really hard.
Yeah.
It's really hard.
I mean, it's like any other industry, right? Like not everyone is going into medicine to help people. They're just perhaps really good at what they're doing or...
There's so many reasons.
Right.
And the system is not set up to... It's just, there's so many, systemically, there's so many problems.
Yeah.
Time is a big one. And I think... A lot of clinicians will think, I don't have time to do that, when you actually do.
Yeah. So I come to you, I have the tight pelvic floor.
Yep.
What can I expect? Like if you are working with the PT and I have a program for X amount of time, can I expect to ever get to a baseline of... Okay.
100%. Yes, it's a partnership.
It's a partnership.
And yes, you can expect to get back to a baseline of
and that's
a
with
healthy
everything.
Pelvic floor.
Like that's with maybe not prolapse without surgery, but
it depends, right? Prolapse, it depends. It depends on how significant it is. Sometimes you do need to do surgery because it's so significant. That's the patient coming in urgently saying like, oh my God, like something fell out of my vagina
Right.
and like her uterus is like hanging
Right.
out. But
Right.
that's incredibly rare.
Right.
Incredibly rare.
So what are some other things, what are tools in your toolbox that you provide women to help them with a new number of issues?
Right. So I think people always say, how long is it going to take? And I
Right,
always
because
say,
everyone wants everything
I would be
yesterday.
doing you a disservice if I told you this would be fixed in, 6 weeks. And I always say, well, how long have you had, like whatever's going on, like how long has that been going on? It's a long arc. There's so many things we have to make sure you've got, like you're optimizing the blood flow, right? Like that's where the local hormones can really help. We have to and that's where you have to make sure those, if they're super tight, overactive pelvic floor muscles, that restricts the blood flow. Tight muscles, it's a lack of blood flow. They work in tandem. The muscles are tight, they're not getting enough blood flow. You got to fix that. You got to work on that, right? So there's like the blood flow piece. You got to make sure that locally for the vulva and vagina, the hormones are optimized so that the tissue is super healthy.
Yeah.
So it can get you back to that baseline of healthy, functioning pelvic floor. So it depends. I mean, it depends, it's complex.
Yeah.
So I don't know exactly how to answer that question.
So in what scenario are these like vaginal weights or exercisers or something like that?
Yeah.
When would you use those?
When would you use those? So I love for people to develop their own sense of biofeedback, right? Like their own mind-body connection. So something like a vaginal weight might be able to help with that. But ideally, I want you to be able to feel it yourself so that you don't need the weight. Or like
feel
even
it
these
yourself,
pelvic floor,
meaning
that when I
like
say,
you're contracting.
I want you to know that if I say, okay, like take a breath in, feel your diaphragm descend, and feel your pelvic floor, we find language that works for you. Relax, expand, lengthen, drop. Like you'll usually find something will be like, oh yes, that works for me.
Yeah.
Opening like like the petals of a flower, whatever works for you. And then you start from there. And you're connecting your mind and your body. And that's like a pelvic floor trainer, like you're seeing that visually, but I want you to develop that for yourself so that you don't need something like that.
Right.
So I rarely use things like that in my practice.
Okay. That's helpful.
Because usually my patients, with the right instruction, will be able to connect the mind to the body.
Yeah.
Because that's what it's all about. It's people are so disconnected from their pelvic floors,
Right. Right. We're all walking around so disconnected from our bodies in general.
Totally.
When I was pregnant and lifting and then just sort of had taken that throughout really exercise, but in general, I love breath work as just a calming mechanism.
The best.
And so what I latched onto was always like zipping up. So like, as you're exhaling, like pulling it together and zipping up. And I don't know, for getting my diastasis back together and what I was thinking of bringing my pelvic floor up. Can you do too many exercises like that?
That's a really good question. So it's complicated because there's 3 steps. There's the relaxation of the pelvic floor, the lengthening, what happens when you take a diaphragmatic breath.
Yeah.
Then when you're contracting your core muscles, that's a very like sustained, but not like it's a sustained contraction of your pelvic floor muscles. The Kegel is the lift and the squeeze at the end. So it's 3 parts. It's the lengthening. Like I always say, like you're going to inhale, your pelvic floor relaxes. You exhale, you pull all your belly muscles towards your spine. And at the very end of the exhale, can you lift and squeeze your pelvic floor?
Yeah.
So it's 3 parts. So people get into trouble when they're trying to rehab a separation, a diastasis, when they're doing the contraction of the abs, but they're doing the contraction and the lift and squeeze at the same time.
I'm like trying to measure what I'm doing.
Yeah.
Right now.
So then they're staying in a constant state of lift and squeeze. So
Yeah.
for example, I have a lot of people that their tipping point will be, oh, well, I was fine. And then I went to this mat Pilates class. And Pilates is amazing. I love Pilates, but you have to be super careful that you're not spending 45, 50 minutes in a Kegel, right? Because you can contract your abs and not be in a Kegel.
Okay, that's very interesting. It's not me doing a Kegel right now, but I'm trying to think about that in the context of dance as well, because we're always lifted in that sense. And your pelvic floor is, in dance, not tucked. And in Pilates, it's tucked under.
Sometimes.
Okay, sometimes.
Right, so there's neutral, there's tucked.
Yeah.
And then as dancers, you're in extension, right? You're in what we call a lordotic curve, when you have that exaggerated curve.
Yes.
So that puts strain on your pelvic floor muscles. When you're in a tuck, that's what we call a posterior tilt.
Okay.
That is a position that literally will encourage the lifting and squeezing and contracting of your pelvic floor muscles. You have to be careful. That's why, the pelvic floor is having its moment, everybody do Kegels, is problematic. It's the pelvic floor is having its moment, everyone should breathe with their diaphragm, because you can't strengthen muscles that you can't relax.
Okay, that's really helpful.
People don't want to hear that. People don't want to hear the relaxing part. They want to hear the I'm going to just squeeze my pelvic floor muscles all the time, and then they overdo it.
Right. Well, where did Kegels come from?
That's a great question. I used to know. I would have to look it up again.
Well, because one of your programs is Beyond the Kegels.
Yeah, that's the name of the Pelvic Floor Foundation course. Yeah,
that's amazing.
Yeah.
So,
I love that it's having its moment. I do.
Yeah.
But it needs to be on the relaxation part, not the strengthening part.
Right.
Because the lengthening and relaxing works for every body. And the strengthening and the Kegel, the lifting and the squeezing does not work for everyone. It's not universal, and the breathing with your diaphragm is.
In terms of other universal things for women to think about, because my assumption is there's not a lot of things, but it sounds like breath.
Oh, yeah.
What about, we were saying the usage of a squatty potty for just anatomical bowel movements.
Yep.
What about, I keep hearing, okay, don't hover on the toilet seat. You're out and about and you're hovering or pushing out when you're peeing. Are those things is that really something that you shouldn't be doing? Is that really affecting your pelvic floor?
You don't need to hover.
Yeah.
And I don't think you need to push. So I think those are universal things. I think if you're asking about universal things, sitting on both of your sitting bones when you sit.
So not what I'm doing right now.
Right. Not that I wasn't doing it either, but if you take your hands, your sitting bones, your ischial tuberosities, if you sit on them, right? If you're sitting and you just start to notice, do you notice, are you sitting equally on them? Usually when you first are asked that question, you're like, oh, not really, right?
Right, you're sort of leaning.
Exactly. So just notice where you are and then see if you can start to even it out a little bit and be sitting equally on your right sitting bone, your right ischial tuberosity, and your left sitting bone.
Oh, interesting.
Right. So that alone puts remember, pelvis means basin, and we want the basin to be level. So that is a huge step to bringing that levelness to the basin.
Yeah.
Pelvic floor dysfunction happens when there's the bones of the pelvis, the basin, are not balanced, when they're not aligned. That's really, if you want to talk about one of the roots of pelvic floor dysfunction, it's that. So if you can sit on your sitting bones equally, your pelvis is in neutral. You're not tucked. You're not arched forward. You're in neutral. That's one of the best things you can do for your pelvic floor.
So our culture is very sedentary.
Yeah.
Do you like the idea of these ergonomic chairs? Do you think that people, is there any tips for people that are working in a very sedentary position in the day?
Well, I think you don't want to ever sit for more than a half an hour at a time.
Yeah.
I like a standing desk. So I think standing is something also. If you ask mean, you can even stand. If you stand up and you ask your patient, like, close your eyes and tell me, do you feel like you lean forward, back, side to side? And I'm talking about like the outside edge of your foot or the inside edge of your foot. And it's so interesting because we're not symmetrical beings. And you'll notice like, oh yeah, I do kind of shift to the outside,
I'm on the left.
or I lean forward or I lean back.
Yeah.
So what I say to people is most people have an electric toothbrush. It's 2 minutes. So when you're brushing your teeth, try to stand equally. The ball of the foot, the heel of the foot, the inside arch, and the outside arch. And that is elegant, simple, and so impactful for keeping your pelvis in a neutral position.
Is there
Universal.
anything in terms of sleep that we should be doing to sort of help keep our bodies in a position? Like, is it worse if you're a side sleeper or anything like that?
I think the most important thing is to sleep,
Yeah.
right?
I'm
Like
working on that.
you need to rest. Your body needs rest. So however you can get that, I think is the most fundamental. And then, we can dive deeper into the actual sleep position. But I think number one is you have to sleep. Your body needs to rest and replenish.
And outside of your practice, is there any one modality that you work with the most? Like, is it chiropractors? Is it acupuncture to get the blood flow? Like,
I love all of them.
yeah. For you specifically.
For me.
In general for your practice,
Sure.
but what have you really loved?
I love myofascial release.
Okay.
I have an incredible chiropractor who does craniosacral work as well, and a little bit of energy medicine, and she's wonderful. I have done acupuncture. It's not like in my regular rotation, but I love it, and I have a wonderful mentor. He like incorporates everything. I would say it's a lot of, like some visceral manipulation and myofascial release. He's one of my most important teachers for everything, for all the pelvic floor work that I do.
I never ended up doing craniosacral, but I was referred, my sister-in-law had told me to do it in the scenario of like giving birth because the baby's like, they're coming out, they were in the position for, 10 months.
Yeah, for sure. For you or for the baby?
For the baby.
Oh, yeah. Yeah.
So, like, it may not be colic. It may not be any of these things. It's probably because their nervous system needs to be reset.
And they have fascial restrictions because they've been in some position kind of squunched.
Yeah, right. Oh, the newborn squish.
Yeah, but they're so flexible that you can get, like we call it myofascial unwinding. It's amazing because I'm a family nurse practitioner. I can treat everybody. So I do have moms bring their babies sometimes, and it's amazing. Gentlest touch, and the baby will just completely unwind. It's wild.
You just see them relax.
Yeah, it's just, every time I'm like, wow, that really does work. That's so cool.
That's incredible. One final question, and then we can go into some final thoughts and a quick fire round.
Yeah.
What would you say to women in terms of just things that they can do outside of the visualization and the breath work? Do you recommend certain types of exercises outside of Pilates that you think can help strengthen or lengthen and do all the things that we should be doing for relaxation?
So number one, do what you love because you're going to do that, and move, right? Move is the most important thing. So I love gyrotonics.
What is that?
It's so wonderful. So probably any gyrotonics people listening is, I'm not a gyrotonics instructor. I'm a student. It's a beautiful, think about like Pilates meeting Tai Chi.
Oh, cool.
So you're doing a lot of things against resistance and you're moving in all these really cool, you have a lot of rotational movements. Pilates is very, lateral, like it's very linear, right? Like you're moving in linear, like front to back or side to side. Gyrotonics has all this beautiful rotational work
Which
that you're
is so
doing.
important for your trunk and
It's just incredible.
Yeah.
So again, that's speaking from if you have the resources to be able to do that. I think that, but number one, do what you love to do. Walking, swimming, anything that you like to do, anything that's improving blood flow is helping you.
Sex.
sex is amazing. As long as there's no pain.
Right.
Then I'm fine with it. Yeah, sex is great. They've done studies like it. I mean, it's such an incredible booster of blood flow. Like improves your brain health.
Yeah.
Yeah, it's incredible. Assuming there's no pain.
Right.
That's
100%.
number one.
Just a quick note on that, because I know you addressed the vaginismus before.
Yep. That's the involuntary contracting of your pelvic floor muscles.
Just so women are aware.
Yep.
There was something else. Dyspareunia?
Dyspareunia, yeah, that's
Tell me
pain
about
with sex.
that. Okay, that's pain with sex.
Yeah, and
Is
that
there-
can be like superficial, meaning entry pain. That can be deeper pain. That can be pain with thrusting.
Do you see one over the other with postpartum?
No,
Okay.
that's universal.
Universal.
Mostly
Yeah.
because if you're breastfeeding, the tissue it's remember, you're hypoestrogenic. You're in
Yeah.
a low estrogen state. The tissue's super compromised.
Okay. Interesting.
And you need lube.
Yes.
Whether
What-
you're
we should-
postpartum or anytime, you need lube all the time.
Yeah. How do you feel about like lubing your tampon? Do you need to do that?
Oh, I mean, you could.
I was just.
But you shouldn't have pain when you put in a tampon. And if
Yeah.
you do, you need to talk to a pelvic floor person because we don't want it to be painful.
Yeah. Okay.
Yeah.
Are there any myths or misinformation out there that you're seeing on social media that you want to squash so that women aren't doing it or using it for pelvic floor health?
The Kegels.
Yeah, don't
It's
do
not
it.
really a myth. I mean, they can be help.
Right.
It's so much more nuanced
Right.
than that. And if you're going to do one thing, breathe with your diaphragm.
Okay. What do you think about these vibration plates? Because in my mind,
Yeah.
I'm like, that could be interesting for blood flow.
I don't know what a vibration plate is.
So there are these, they can either be lateral or up and down,
Oh,
and
cool.
it's supposed to, you're basically jiggling.
Oh, like an Emsella chair? Or
No, it's a platform you
it's-
stand on or you can sit
Oh,
on.
okay.
And it's supposed to, I haven't seen any science behind it. I have to
Oh,
do my research
okay,
on that.
okay.
But my whole thought is like, if you're standing on it, so
Have you done it?
and you can confirm when we have our appointment.
Yeah.
But that my pelvic floor is strong and
Yeah.
it is fine. However, when I go to the trampoline park and I try to jump higher than my son, I might have a little bit of leakage.
Okay.
Which is called something.
Urinary incontinence, urinary incontinence.
The stress thing.
The
So it's
stress
maybe
thing.
I don't have an issue. It's just maybe that specific pressure could cause that, right? Mm-hmm. So
And
the vibration.
We've been normal. Like we think that's normal. It's common.
Right. Like peeing when you sneeze, these like
No,
funny jokes of like
we'll
you're-
work on that.
Right.
Yeah.
So like
no,
we need to
you
get away
won't
from
have that anymore.
Yeah, we need to get away from that.
But you won't have that anymore once you come to see me.
Okay, I
We'll
love
work
it.
on that.
Yeah,
Yeah.
thank you.
Like
So
they
the
shouldn't have like pads in the bathroom at
Right.
the trampoline park. I know that they do, and I know that they're helpful, and
Right.
it's like a larger systemic problem which
Right.
we've been addressing.
Right.
Yeah. I didn't mean to interrupt you. Go
No,
ahead.
meaning like we need to get away from it because it's not like I have the most badass woman that I know. She was in the military. She's now a doctor, and she's like, yeah, I'm running and I'm peeing.
No.
And so, it's
No.
anyway, anyone listening, if
No.
you're peeing at all, leaking, like you can go to a pelvic floor therapist and
Totally.
get some support.
Exactly.
Okay, this is the keep it light round.
Okay.
So for you personally, what's one wellness trend that you've found recently that you've leaned into?
Biomagnetism.
Right, you sent me this and I need to go.
Mm-hmm.
Okay, tell our listeners what that is.
I'm not like 100%
It's
sure.
euphoric.
Yeah, I know. It's
Sounds
just
euphoric. Like,
it's all about like I don't know. She starts and she
yeah.
either uses a pendulum or puts your feet in these magnetic boots. And then she
Yeah.
comes up with this plan for you. I don't know. And then all I can say is like you feel really good after you do it. And then she's like, okay, you need to come X amount of times. I think based on
Yeah.
what she's assessing,
Energetically feeling.
what she's
maybe?
energetically feeling.
Okay. I'll try
and then
anything
she has
once.
these different protocols. And then, she's like, okay, so you need to come this many times. And then she said, I would recommend you come with the season change or with any big changes.
Okay.
I don't know.
We're going to look into
that.
that.
But I loved it.
I love it. When do you go next?
Well, I graduated.
Oh, congratulations.
So, thank you. And so she said, come with the season change unless something else comes up. So, and I will have to invite people to look up what biomagnetism is.
We'll look at it and we'll link it in the show notes.
It's been really helpful just in terms of making me feel just more secure and stable in myself.
I love it. I actually recommended it once you sent that to me to a friend who has Lyme.
Oh, yes. This is the person I saw. That's how she got into it.
Yeah. Oh, interesting.
Yeah, she was like some incredible computer scientist from MIT. And then she got Lyme and got really sick and nothing helped her but the magnets.
Amazing.
And now she's a practitioner.
Okay. Because you're hearing Lyme left and right now. So that would be a great tip for women to look into and to investigate.
Yes.
Favorite personal care product, not lube. Because we already talked about lube.
Right, not lube.
Or you can say your favorite lube, if you have one.
Oh. Yes, I love Coco Nu, the oil-based lube.
Oil-based. Mm-hmm. So again, you cannot use that with condoms because it will counteract.
That's right.
Okay.
It'll render the condom useless.
Yes.
But I love that. It's super nice.
Okay. Last thing that you Googled or asked chat.
I'm always asking it the same thing. How can I make it more clear what I want to say?
Okay.
Whether it's patient-facing, educating clinicians, it's 9 times out of 10 a version of help me to make this clearer so that there's no overwhelm and people know, whether it's a patient or clinician, they know the next step that they have to take.
How awesome is that?
Yeah.
That you're synthesizing it and just making it that much more digestible. That's such a smart way to use
that's a passion of mine.
Yeah. Leading with empathy in the way that you're speaking to people. That's awesome.
Totally.
I love it.
It's my passion.
I love it. Lastly, a podcast, book, or resource that you would recommend to women.
Better Sex Through Mindfulness by Lori Brotto.
Okay.
Or Come As You Are by Emily Nagoski.
Okay. I love it.
I have two, but...
Yeah, thank you.
You're welcome.
Lastly, where can women find you, your programs, clinicians, all the good stuff?
So patients can go to patients and clinicians can go to either one, but my clinical practice is pelvic health support, and then the educational platform is the Institute for Pelvic Health.
Amazing, and same on TikTok and Instagram.
So I think.
I can just link it as well.
I think it's Pelvic Floor NP on Instagram and TikTok.
That's okay. We'll link it and everything. And
Thank you.
Yeah.
Thank you.
This conversation is awesome.
Thank you so much for having me.
There are so many amazing nuggets, and I've learned so much from you on the pelvic floor, and I cannot wait to come meet with you and explore my body and start to learn and help myself. And so thank you.
Thank you so much for having me. And I love what you're doing. I love your platform.
Thank you.
I love all the ways that you think about connecting and helping women.
Thank you.
Like that, it's such a beautiful thing that you're doing and creating for us. And people will benefit so much by having reasonable, thoughtful discussions and learning, right? Like you're filling a gap that is so needed, because when there's this huge gap, all this crazy shit fills it. And so what you're trying to do and what you are doing with your platform is you are saying, no, like, here's what the Western practitioners say, or here's what the evidence-based medicine said. And then here's how we can integrate all of these really cool, holistic, integrative ways to practice to actually help you to feel better and more like yourself. And that's what you're doing, and that's an incredible gift. We need
so much
more of what you keep doing it. It is so needed. You're welcome.
Thank you. And thank you for being a part of it.
Totally.
I'm so excited to see how we can continue to work together. And
Me too.
So for all of you listeners, please subscribe to Off With Your Coat. Follow @GenWellOfficial on Instagram and Gen Wealth on TikTok. And stay tuned for more for next week. Thank you.